Yes. Shall I?
It's
Okay.
now recording.
So,
Hello, this
okay.
is Douglas DeBecker with Fallamurtham Institute and Dr. Mahesh, and we're
Yeah.
here discussing Ayurvedic psychology, Manasroga. Hello again, Dr. Mahesh. It's been some time. Thanks
Uh,
for
yeah.
spending some time again for us to speak.
Yeah. Hey. Hello, Douglas, and hello, everyone. We are again back here with our recording series. Okay. So, last in the last series, we have discussed regarding some of the basics of mind and mental health and functioning of the mind and emotions and emotional disorders. And today's discussion, we would be discussing like how would we diagnose the mind, mental illness, and other illness as per the Ayurvedic principles. Over to you, Douglas.
All right. Yeah, thank you.
Okay. Okay. So, do you have anything here to refresh and record from the past recordings?
Yeah, I can't see your screen right now. Are you doing
I didn't share it. I didn't share it. I am
okay?
sharing it now. Okay.
Okay. Share the screen is
So, okay, can you see my screen now?
not yet.
Okay. Share, post. So you have disabled the attendee screen sharing. So you have to enable it, I think.
I do.
Yeah.
Okay, one moment. Huh.
Yeah. No, it's okay.
Can you see it?
It's you have a disabled recording, but screen sharing is not allowed.
Screen sharing is not allowed. How do I do that?
Once I'll see in my settings. Okay. Share memory. Okay. Once again, it's not working. Host
Oh,
disabled
yes.
attendee screen share.
Okay, I fixed it.
Okay.
That should work.
Yeah. Yeah. Yeah, it's working now. Yeah, desktop I'm sharing. Yeah, can you see the screen now?
Yes. Okay, perfect.
Okay. So this is the screen. I think in the earlier classes we have discussed regarding some of the basic aspects like Tridosha and the mind. I think if you recall from the past recordings.
Mm-hmm.
Okay, so continuing with that, today we would be diagnosing like how does the diagnosing happen as per Ayurvedic principles. So basically in Ayurveda, we have like a threefold examination system to understand the nature of the disease and also the nature of the person suffering, and also what are the influencing factor, whether the diseases happen due to the impairment in the diet and regimen as per the patient's prakriti, or there are any other influencing factors other than the diet, uh, our diet and lifestyle. And what actually these threefold examination will help us to explore, along with the influencing factor, what is the strength of the disease, whether it is a severe disease, mild disease, or moderately affecting disease. And also it helps us to better understand the nature of the person. So whether the person is able to sustain the effect of the disease, how is his like a immune, how is his digestion, how is his metabolism, and what will be the influence of the affected disease over him. It is called as a rogi bala. That means the strength of the patient with sustaining the effects of the disease, and the roga bala, and that means what is the strength of the disease affected. Next, to explore this, we have 3 types of examination, 8 types of examination, and 10 types of examinations. Okay, so so usually what are the 3 types of examination is by seeing the patient. How does he look? Whether he looks tired or like a weak, or he's okay with the appearance and his skin color, texture of the skin, and his eyes. How does he walk? How does he sit? So this is all by the vision. And next one is by touching of the patient, whether the body is cold, warm, whether each part of the body is same, like a temperature is same to in all the extremities of the body. And examinations like touching the parts where usually it is affected, like by touching the chest, by touching the abdomen. And uh, and also after examination, it is called as a physical examination of the each systems. And lastly, asking the questions like how does he feel, whether did he eat something, regarding asking questions regarding the etiological factors, or how he or she is suffering, what is the condition now. And if there are any doubts regarding then what the patient is feeling, or regarding some of the diet history, regimental history, and family history. So like that, by seeing a patient, by touching the patient, and by questioning the patient or examining the patient, this is called as threefold examination. And next examination, which is like elaborate when we go for a systemic examination, is eightfold examination, where, as you see in the picture, it is called as a pulse examination. So in Ayurveda, we have this eightfold examination. One is the Nadi Pariksha, or the pulse examination. So the pulse examination is related to understand the nature of, one is what is the nature of the patient, and next one is the nature of the disease. And as per Ayurveda, we have no we have a system called as a Tridosha, Saptadhatu, Saptamala. That means what is the component of the disease. Like body is mainly built up of, or as we have learned earlier, three driving forces, that is Vata, Pitta, Kapha. And then the structural entities like tissues in the body, they are seven in numbers. And then there will be metabolic wastes produced out of these doshas and dhatus. And they are also whether they are expelled, produced or expelled out of the body in a proper time or not. And how is the patient's metabolic state at the level of digestive system and at the tissue level. Okay, so these are all examined or understood just by examining the pulse or nadi. So once we know that whether these are in a proper state or in a disease states, so these are examined and understood through the nadi. Next one is after this nadi, we'll go for examination of the urine. So how does the, what is the quantity and quality of the urine, whether it contains any other extra things like sometimes we have one topic called as like a prameha, or excretion of excess of urine, which is nearly around 20 types as per explained in that Ayurveda. So sometimes the urine may be consisting the secretions out of the body, like the urine color may change due to some of the components mixing with the urine. So whether the urine is normal, quantity and quality of the urine is normal, or it is in a disease states, or sometimes it is turbid, sometimes it is mixed with some greasy things, sometimes some maybe gruels and other things. These are all examined and understood. From examination of the urine, we can understand the underlying disease. So in Ayurveda, I'll just give an example, like how by examining urine only, we have a medicine. Okay, there are like in our text explains like 20 types of this what do you call problems in the urine. So by seeing the color and the texture of the urine, text explains the different kinds of medicine for these 20 types of afflictions in the urine. And if those medicines are used, I think that conditions may be treated. Nowadays, we see many diabetic patients. And this diabetes is also explained under this topic of urine examination. And once who follows these medicines may be getting rid of these problems originated out of the urine production and urine excretion problems. And next, there is one more system of utility of urine examination is in Ayurveda, that is called Mutra Bindu Pariksha or Taila Bindu Pariksha. So what is that? Like a drop of oil. The early morning first flow urine is collected in a bowel. Around like 100 ml of or 50 ml of urine is taken, and then a small bowl it is kept, and the sesame oil is taken and dropped in the mid of the urine. And based on the direction of the flow of urine, the prognosis of the disease is understood. But that means one can predict whether the disease is going to be getting controlled or cured, or the patient is going to develop any complications, or he may die. Like that, so many predictions can be done as per the textual explanations. So this is called as a Taila Bindu Pariksha or Mutra Bindu Parikshas. So this is a Nadi Mutra. Next, Malam, like examination of the excreta, which explains like how is the bowel movements, whether he is passing the stools properly or not. This is one thing. Next is the expulsion of urine, and also third one is sweat. As per Ayurveda, like urine, sweat, and fecal material. These are called as the three main excretas out of the body. So this has to be produced and expelled in a proper quantity and quality at right times. If there is any variations in these periodicity, one should understand that there may be some variations in underlying systems. So suppose by example, if sweat formation is reduced or excess, one will understand there may be some underlying metabolic problems. So sweat used in Ayurveda is understood to smoothen the skin or to maintain the temperature of the body. In almost all the skin diseases, the formation and excretion of the sweat is affected. So one coming for with a problem of skin disease, or one who's having excess or lack of sweating, is understood that he may develop any skin ailments, or there may be some problems with the foul smelling of the sweat. So there is some medications. One has to understand the underlying metabolic error, which is related to fat tissues or medodhatu. Okay, so one can predict that he may develop some of the metabolic disease in the future. And also there are suitable medications for treating this sweat related problems also. And I have already explained regarding the urine examination. Next is a stool examination. So stool color, texture, and other proper quantity and the time of expulsion is understood. And if there is any variations, the underlying problems are understood based on the clinical features explained for different diseases in the text. One example is that there are two types of jaundice, or okay, from what is called Kamala in Ayurveda. So that if there is a two in that, stool examination is on two types. So one is with this yellowish discoloration, and one is with those yellow discoloration. The one without the yellow discoloration is understood that there is some blockage in the bile excretion. So that's why the stool has not got the yellow color. So from that, there is a different set of treatment for treating that condition. And the stool with a yellowish discoloration and the body is discolored yellow, there is another set of treatment for that. So by examination of these things, we can get a proper understanding of what suitable protocol has to be selected for treating that condition. And after this next examination, along with this examination of the sweat, examination of the urine, and examination of the stool, there are other sub or small there are many other excretions have been explained in the body, just like the ear wax. That is also one of the khermalas, they are called as. That is a lower grade excretors. So if there is a lack of production or excess of production, so there is a suitable treatment for that also. And excessive secretion from the eyes, it may be tears, or it may be some sticky things. So if it is so again, the production of these malas are influenced by the dominancy of the doshas. I'll give an example. If there is any vata doshas influence over the eyes, so vata is like so if there is excess of vata, there will be definitely the dryness. Due to the dry nature of vata, the body will get dry. So there will be lack of production of secretions in the eyes, including the tears. So even though the person cries, the urine production will be low, and the eyes will get dry, and the secretions in the eyes also get dry, and the patient may develop dry eye syndrome. And if there is an influence of pitta over the eyes, so there will be some redness in the eyes, burning sensation in the eyes, and there may be some inflammatory disorders originating in the eye. And if there is any kapha influence over the eyes, the person may have excessive secretions, not in the sense of quantity, but also in the change in the quality. He may develop very, very sticky secretions in the eyes. So by seeing this, we can understand the underlying influencing for force in the body, and suitable medications are taken for vata, for pitta and kapha. And if it is understood and applied, and the person may get rid of that problems. Sometimes there may be dual combination of these doshas, or all the doshas may also affect particular organ. This is one example I have given regarding the eyes. The same happens in the nose also. Dryness of the nose in case of vata, burning sensation of the nose in case of pitta, and excessive secretions and sticky secretions from the nose in case of kapha. So the same as per the treatment protocol is selected. Next, in the ears also, dryness or hard ear wax and inflammation in the ear, mid ear, and again excessive sticky secretions of the ear wax. Okay. Next, again, all those things like, and production of nails and hairs. So these are also the prognostic things. If there is excessive production of the hairs all over the body other than the normal face, and like nails also. So this, and also there, if there are any problems in the tendons and ligaments, these are also understood as metabolic errors. Okay. So nadi mutram malam. Next one is the examination of the tongue. So in Ayurveda, we explained regarding the how to understand diseases by examination of the tongue. So by examining the tongue, one has to see that whether there is a tongue is clear or it is coated with different colors. If it is white is coated, when Ayurveda explains that, one need to understand that there may be some error in the digestion and metabolism. The person is not able to digest what he is eating. So that is understood by examination of the tongue. Okay, so if the tongue is clear, it is understood that the digestion is clear. So, and also in case of diseases like rheumatoid arthritis and other immune diseases or indigestion, then definitely the tongue is coated with the thing. So there is a suitable medications for this. And if it is applied, and it can be, as we can understand, as we can get an idea of what protocol we have to use in such a things. And if there is any reddish inflammation, that explains the influence of pitta in the body, or some of the inflammatory afflictions are happening in the body. And yellowish discoloration, as we know, it is influence of jaundice. Okay, and some portions also, like a front portion, mid portion, and the back portions. And also variations in the feeling of tastes. If a person is feeling more salty in the tongue, it is understood as the influence of excessive kapha in the body. If the person is reduced taste in the body, it is understood in the influence of vata. And if there is any variations in the food, or food what was he was taking earlier, now there is a variation in that, it is understood as influence of pitta. Okay, so Douglas, do you have any questions here to ask?
Yeah, general question.
Yeah.
Basic question is that this is the same diagnosis that you're doing if a person's just coming in with a physical complaint, yeah?
Yes, in all these things we have to examine all conditions, whether it is a mental or physical, because the physical doshas have influence over the mental illnesses. So before coming to the diagnosis of mental illness, we need to do a basic examination with that he's not been suffering with any of the physical illness. Then, because many of the physical illness will influence over the mental illness, such as diabetes is there. Diabetes can cause a small amount of depression due to the lack of insulin in the patients.
So,
and yeah,
after diagnosing and choosing a remedy, are you choosing a remedy a little bit different because the person has a psychological problem?
Yeah, definitely we'll apply some of the other protocol just by how to apply this, because suppose I will take a kapha dominated patient. You have got a proper protocol and you will explain the patient. But for a kapha person, it will be very difficult to follow the diet and regimen. So we need to do some of the mental stimulators like that, which motivates him to exactly follow the protocol. What happens? You prescribe a medicine for 2 weeks calculating, but next time when the patient comes for the next visit, we see that still he has the medicine. it makes us understand that he has not followed the proper protocol. So this is the usual mentality with Vata, Pitta, and Kapha. I'll give what example. If Vata influenced person is there, he may finish all the medicines in a very short time. He is very fond of taking medicines. So we had to check the medicines. Like he may come early. So 2 weeks, like 50 days follow-up is there, but he comes on the 10th day telling that my medicines were over. So this is the mentality. Well, Pitta people will follow properly what is being explained. But Kapha will come with remaining, still I have medicines. So then you check up, then they told, I forgot to take one time, like that they will tell. So these are the mentalities. So we need to understand this, and we need to develop a suitable protocol, what to be done. So in case of Kapha, we'll advise anybody to follow that the patient is been taking. In case of Vata also, we will give it to some attender and we ask them to give at a suitable time. In case of Pitta, we just explain and we'll be screening that. And also we'll be adding some of the mental medya dravyas like Shankapushpi, Vacha, with all these things in case of mental illness.
So you're giving, so let's say the person has a physical problem. You're
Yeah.
giving them a remedy for their physical problem. And
Yeah.
because they've come in actually for a psychological problem, you're going to stack the physical remedy with another, with some extra drugs or herbs or therapies for their psychological problem.
See, there are two conditions in this. Like a patient doesn't understand that it is from physical illness, such as a depression. Patient comes, but basically he will be having a hypothyroidism. Okay. If the patient understands, we explain that it is from physical illness, and we treat mental illness simultaneously, giving more prominence to the physical illness. But most sometimes what happens, the patient is not ready to agree that he has a physical illness. So at that time, we just, without the notice of the patient, will be treating both. So this is what going to happen. But the goal is to that we need to give a remedy for that. And the same thing happens in vice versa. The person will be having psychological illness, but he may be presenting it in the form of physical illness. So at that time, he may agree, he may not agree. It depends on by examination. Just like it's called a hypochondriosis, what we call as hypochondriosis. So he will be having a mental illness, but he will be presenting physical complaints. There, as per the patient's mentality, we go on for adding the treatments. Especially in case of mental illness like hypochondriasis, there is no need of physical treatment, but just to convince the patient, we are targeting the mind indirectly through the body.
Okay, so whether a patient comes in for psychological or physical problems, you're doing the same diagnosis, basically giving the same remedy, but you're tailoring it according to what the patient's complaining about, that the patient feels that they're being taken care of.
Yes, that is the thing. We have to tailor it as per the conditions of the patients. So that's why we call it as a customized, and we need to thoroughly examine. That's why even though it's a physical examination, but I am adding it here regarding in the mental health scenarios. Because see, like we are not just focusing on mental illness, but we need to understand the strength and the metabolism of the patient. So we need to have a thorough examinations in psychiatry, especially to know whether we can use what kind of medicine. Whether see, there are so many things that we use so many medicine, but we need to understand whether this person is able to digest these medicine and utilize this medicine in his body. So that's why a person has to be very, very thorough in understanding the strength of the patient and his underlying present condition when it comes with the illness, either it is physical illness or mental illness.
So it's possible you could find very little wrong with the person physically that would explain their mental illness, and in that case, you would then proceed towards a deeper analysis on the psyche of the person and other medicines that they might have to take. And then at the same time, or in other situations, you might find that their physical situation explains some of their mental issues. And so you might not really have to give much medicines per se for the psychiatric problem or psychological problem, because of the connection it has with the physical issue that you've discovered in the diagnosis?
There is one answer for all these questions. Like, see, what is explained in Ayurveda is that how to reach the mind through medicines. As per the explanation, like how is the mind nourished is that when we take a food, when the whole body from dosha, dhatus, and malas are nourished, then a very small portion of that for food will be reaching the mind. That means for nourishing the mind, the whole body has to be nourished thoroughly. Then only the mind is getting nourished. So, like that, when we give the medicine, we may not directly reach the mind. Only after settlement or fixing of all doshas and dhatus and malas, then only we can reach the mind. So, it is very important that his physical health is important before reaching or correcting the mental health.
Mm.
So that's why basic idea of correction of all these physical things is required before going for treating of mental ailments. So now we, as you asked, like based on patient's conditions, patient's acceptance, and the suitable protocol, we will tailor what should be applied first, what should be applied next, so that we don't miss this patient from undergoing treatments. Because in psychiatry, that is a big problem, that patient may discontinue the treatments. So that is why we see that like how to tailor the treatment protocol so that it can be applied at all levels and the patient is benefited.
Mm. Okay, thank you.
Okay. So, uh, any other things?
Uh, I do have another question, but I think it can wait till a little bit later after you've covered some other things.
Okay. So after and examination of the tongue, I explained. Next is examination of hearing. Okay, or some of the sounds produced in the body, or how does he hear? Whether he has any hearing problems and other things. That is called Shabda Pariksha. And then as we call as Sparsha Pariksha, that is touching different extremities and examining. And examination of the physic. Now I will add how to, let's call it as a body morphology. As I have discussed, I think in the earlier sessions, that body's morphology will help us to understand the mental illness very well. Like there are three types of morphologies as per the modern anatomy. One is ectomorphic, mesomorphic, endomorphic. So ectomorphic person will be looking like a tall, short, and his body is like a dry, and is looking like a malnourished or undernourished person, just like what has been explained in Vata Prakriti in Ayurveda. A mesomorphic person will be appearing like a very muscular and athletic type of body, very correctly built physique. So as explained in Ayurveda, he resembles a Pitta Prakriti. And a very endomorphic, he will be looking round, fat, as like that of Kapha Prakriti in Ayurveda. So what does this morphology is in relation with mental illness is that a person with ectomorphic or Vata Prakriti may, as we discussed in the last session, he will be suffering mainly with the anxiety disorders, or he will be having a neurotic personality, that will be always worried what will happen next, what will happen tomorrow, like that, neurotic personalities. And in case of mesomorphic, he may be susceptible to develop delusional and hallucination disorders or thought disorders or schizophrenia, more susceptible to develop these disorders. In case of kapha, that persons are more susceptible to develop depression and depressive illnesses or depressive disorders. So examination of the patient helps to understand, just by looking only, you get a hint that what may be the underlying prakriti and the underlying illnesses. So that gives a hint so that we can cut short our examination methods. So this is a eightfold examination. The same thing applies in tenfold examination regarding the examination of the doshas, dhatus, malas, and other things. Along with that, I will just put some of the inputs on this nadi. So you can see these three fingers here, vata, pitta, and kapha. So usually this is explained for understanding the physical illnesses and underlying problems. But recently, when I started interpreting this, it also gives a hint for understanding the mental illnesses also. So the first finger, what you see, this is used to understand vata. Can you see this? This my arrow.
Yes.
Okay, this mid finger used for examining the or understanding pitta, and this third finger is used to see for kapha doshas. And usually there is a certain rules and regulations when to examine nadi, when not to examine nadi. Just that has to be followed. And in males, it is suggestible to see the right hand and examine in the right hand. And in females, it is suggestible to examine in the left hand. Okay, as per explained in Sharangara Samhita. Okay, so some of the things that the examination of the pulse should not be done immediately after food or after evacuation of the bowels and immediately after getting out of the bed. So when a person, suitable time is once the patient takes the food, 1 hour after that, and he's not got up from the sleep or anything, he is been free, and 1 hour after taking food is the best suitable time to examine the pulse. And when you examine, there are two things. In a healthy patient, we check the prakriti. It will help us to understand the underlying prakriti. But in case of diseased person, it helps to understand the vikruti. So usually there is a lot of confusion. Many of the people come to us just to please examine my pulse and tell my prakriti. So if the person is mostly healthy, we may tell what is his underlying prakriti. But the person is having a major illness or moderate illness, we can't tell the prakriti, or it is not good to tell the prakriti at that time, because we are especially focusing on the vikruta doshas or vikruti rather than the prakriti. Suppose a nadi is flowing here in this, or wave is flowing, and it depends on whether he feels the wave in this hand or in this finger or the mid finger or the first finger. So it depends. Suppose if a wave is felt not in these two fingers but only in this vata related finger, it is understanding that there is a dominancy of vata. Okay, so if the dominancy of the pulse wave is felt in this mid finger, it is understood that there is influence of pitta. If there is a dominancy is felt in this finger, it is understood as kapha. Okay, and sometimes what happens, it happens in two fingers, so then it's a dual combination, or all these three fingers will feel equally the pulsation or dominance of the pulse. Then it's called as involvement of all the three fingers. So in a healthy person, that shows the perfect health, is very perfect. Okay, and in case of disease, it shows the involvement of three doshas, means the disease is difficult to cure or manage. And here, where to exactly to feel is the midpoint. Here in the mid of the finger, we have to feel that. And sometimes what happens, we feel this and it doesn't flow to the next. When you see physically, the person is of pitta prakriti, but you see the feel the nadi is of kapha. That means the kapha is blocking the pitta. So it is understood like that, like one is blocking the next doshas. Suppose I'll give an experience with one of my student I was examining. The student was basically of pitta prakriti, but in pitta prakriti person, the nadi should be, the pulse should be felt especially in the mid finger. But I was feeling that more nadi in the kapha finger, and it is not flowing properly to the next. Just I thought there may be some metabolic errors due to some blockages. Just I asked, do you have any problems related to the liver? Because liver is the organ related to metabolism, especially with pitta. Then she told, yes, so she has a fatty liver and there is some fatty liver. She's suffering from moderate fatty liver problems. So like that, it is just one example of interpreting. And this is in case of vata, we can understand the bowels and the digestion. And in case of dominancy of pitta, we can understand that there may be some inflammatory diseases going on in the body. Or if you are not feeling pitta properly, there may be a slowing in the metabolism, like weak digestive fire, like that. If there is more dominancy of kapha, it indicates the hypertension. That means more fluid is collecting in the body. So like that, we can understand or interpret many things, but to get a suitable information from the nadi, we should have a overall basic information about the full body and its behavior. Then only we can understand so many underlying problems with this nadi. So now there is a question like, what is the relation between this nadi and mental illness? So if we feel vata, we understand, yes, definitely he's having a jumping mind, or he's not stable, or he's not fixed, if there is a dominancy of vata. Okay, if it is pitta, definitely it indicates the anger, and if it is kapha, definitely it shows the lack of motivation or depression and other things. And sometimes what happens, this is just an interpretation, but we need to basically have a knowledge of Ayurvedic psychology and modern psychology to understand the underlying problems after hearing the conversation from the patient and correlating with what you see in the through the nadi. And what I said, that one who gets trained in this, or who gets experienced in this, will definitely will able to understand many of the underlying mental illness. And this has helped me in diagnosing or understanding many of the patient's information which they don't like to share. Suppose mainly pittas, we understand there may be some conflicts, underlying conflicts. Okay, so usually what was happening is that in one case, the pitta was blocking the flow of to the kapha. So that I understood that this in one patient. So there was some underlying, or else what was happening now? A patient is having a flow of emotions, and that has been blocked, or it is covered, and it is not being expressed. It is understood by the kapha's blockage or the pitta. Especially there is a very dry force towards the pitta, but the kapha is blocking that in the nadi when we examine this. So we can see this three fingers, especially we need to see edges. Okay, so whether it is coming here, this portion, or this portion, or this portion, we need to see. So if it is hitting and not flowing here, or it is going like this, sometimes the nadis just never touches, you never feel this, but you will feel like this. That means it's not at all touching that, or that dosha is coming down. So we need to see whether the doshic level is here, here, or here, or it is just bypassing. So we had to neither keep it here or here, we had to always keep it here. So we need to use the metabolic correctors at that juncture. So this is the thing. And based on the dominancy of vata, pitta, kapha, or sometimes it is dual, if it is vata pitta, vata kapha, pitta kapha, pitta vata, or multiple combinations, we can definitely understand the underlying dominancy of rajas and tamas and its influence over the mental health conditions. Either it may be depressive illnesses, or anxiety illnesses, or schizophrenic and other hallucinations, delusions, other things. So, and pitta and egos and self-understanding, self-identities are very related. Sometimes when it is when we are feeling problems with the pitta nadis, so we need to really work out, like understand whether he's connecting to what he says, or he's showing repelling with others' suggestions, or he's taking other suggestions, or when it is a kapha, whether he's able to negative thoughts are coming, or there is a strong influence of negative thoughts over his thinking process. So like that, and we can understand so many things, and we can adapt suitable treatment protocol and counseling protocol, especially when a patient is not able to share the underlying emotions. We understand them, we ask the question, and we try to understand whether our interpretations are right or wrong. Then we can develop a suitable protocol. Okay, so do you have any questions over these things?
I do. When you
Okay.
mentioned the three gunas,
Yeah.
how are you feeling that in the pulse? Is that the depth, or is that the one side or the other side or the mid side?
Yeah, it's a combination of all things. One is the depth. If it is strong hitting the pitta, so he's very precious and it's very anger. Okay, it indicates his anger. See, if it is a moderate, then his balance of state of thinking and reproducing is normal. If it is low and his self, what do you call, self ego or self expression is being down, in case of pitta. So it is a combination of all, whether it hits here or hits here or hits here, or it is not at all heating, just it is passing by pitta. If it's suppose if it is pitta, so whether it is following like this, just it is going, it is not touching, but you feel it very light. So his self-respect is gone down.
The self-respect relates to which?
Or what do you call his expressions? Or
But I
his
mean,
feeling
are
in
you
the
saying that relates to a
pitta,
particular guna or
pitta,
with pitta? So,
pitta,
yes.
pitta.
Okay. So it's self-expression goes down, the pitta is lower as well.
Yes, 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 yes.
And so you're
And
not
that
really.
may that he,
Go ahead.
yeah, he may be inclining towards depression.
Uh-huh. Okay, okay, okay. And then so you're saying that based on in this particular example, you'd be feeling the pulse primarily in the middle finger for pitta, and
Yeah.
then if you felt it very low, it could
Yes.
be that okay, it's a pitta constitution, but his pitta is actually deficient.
Yes. Yeah. Yeah. Yeah.
And so you're not really looking so much for sattvic. Yeah, it's not
Yeah,
something.
because it's a disease condition.
Uh-huh.
You
Okay.
have to see it in yeah, yeah. Pitta, what happens in sattvic in a normal healthy persons? When you're checking a healthy person's nadi, you may sometimes feel sattvic, but most of the times it's very difficult to get it.
So the tamasic would basically be deficient, and the rajasic would be excess in some sense.
Yeah, it is. If it is more, then we see that he's very aggressive, or he is having a tendency to fight, homicidal or suicidal tendencies. If pitta is too dominant and kapha is too less.
And then what would your example be for kapha? Kapha when rajasic would be what?
Kapha rajasic, that's what I know. When there is a very strong influence of kapha, that means tamas over the pitta or rajas. So negative thoughts will be more, because pitta helps to understand what is right, what is wrong correctly. But whenever there is influence of kaphas over the pitta, the person may see right things as wrong things and wrong things as right things. So the thought process or understanding process will be blocked. So that's
So
what we call is,
you're
yeah,
kind
go
you're
on.
kind of go ahead. That's what you call.
Yeah, that's what we see, that like thought blocking or thought deviations. So many things can have happen from this kapha, negative thoughts. So mainly we feel to, when a person is having too much depression and negative things, we treat kapha there or tamas there to reduce that and help him to come over this depression. And every follow-up we see what is the status of his affected doshas. Then we'll understand how much our treatment has really worked. The patient may say that he's okay, he may feel, but it is not exactly what is happening in his body. He may feel it, but still he will be having the dominancy of these affected doshas in him. So we next decide the next what would be the strength or what would be the next protocol. Suppose we give the medicine and the next follow-up, the patient's dosha condition is still the same. We go on for another protocol, higher potency drugs than that. Or sometimes we feel that only medicines are sufficient. If they are not working, well, then we take for purification in the next. And next, if the purification is still not working, we go for rasayanas.
So one more question with Vata.
Yeah.
Will you be trying to influence Kapha and Pitta in order to influence Vata? Then, if the Vata is weak, will you be trying to,
Yeah. See, yeah, what is understood in Ayurveda is that Pitta and Kapha are not at all moving by themselves. Vata is the initiator for these things. But Vata should be very, very, very well balanced. If Vata is more, it makes a Pitta like jump away, jump conclusions.
Sure. So then, would you be would you be working to balance
Control.
Vata as well as
Yeah.
influencing Kapha?
Yeah, first we will treat it's a very tricky thing, like when you are working with vata and kapha. So we need to strengthen vata first if it is weak. If it is excess, we need to come down. So first, always we have to target regarding the balancing of vata, so as to make our treatment work. So it is a treatment for both vata as well as kapha, but vata has to be balanced.
And then if the Vata is too weak,
That's a
then
very, very problematic condition. We will mainly focus on vata to improve it.
not you won't really try to increase the Pitta.
No, no, no.
Well,
because
I'm
vata is
in relationship to what you were mentioning in terms of feeling the nadi. Yeah, how one is blocking the other. And
see
so,
one, yeah, that's the thing is that, see, usually I'll see there is always a wrong tricky question, like oh, this should be vata, this should be pitta, and this should be kapha. But actually what is happening now, we have been our in our body's location, vata is in the intestines, pitta is in the what do you call digestive, that stomach and duodenum, kapha is in the chest. So like that, this is in this nadi, this vata, pitta, and kapha. So what was your question was regarding the vata? Sometimes what happens now,
I'm
whenever there is a,
thinking of
yeah,
tamas and rajas. Yeah, so if the vata, if the vata is very low, then it's going to have some influence from tamasic. I'm asking if the vata is very strong, will it be having more of a rajasic influence?
see, vatas, no, there is a two nature of, see, there is a vata and rajas are interlinked, but it has to be understood in two ways. If there is a vata, dominancy of vata, there will be too much like what do you call anxious feeling or very fast movements, activities. But rajas is that is due to rajas. But there is one more nature of rajas, that is attaching to the things very strongly. So this attachment is again happening through tamas itself. So a person is very much attached to one thing, like addictions, women, and other things, or sexual addictions, masturbation, and other things. This is happening due to the wrong motivation of the vata, and also wrong influence of excessive influence of tamas or pitta. So here what we are doing is we are trying to first balance vata so that we can control this tamas and its influence over the rajas. Okay, so mainly whether it is neither it, if it is whether it is tamas or rajas, first we need to control vata so that we can handle this both rajas and tamas.
And another point I'm wondering is
Yeah.
nature of vata is changing too, though. Yeah, so for it
Yes,
to
yes,
be
yes.
consistently one way
Mhm.
would be almost unusual, wouldn't it?
Can you repeat it?
So
I did.
if it's not, if it's an influence of, if the result of the vata is is an influence of kapha or pitta, I can
Mhm.
understand that it would be consistently one way. It would be consistently this way or consistently the other way. But if it's not under influence of kapha and pitta,
Mhm.
then it
This
would
is
be changing. Yeah, it would be more changing in its
yeah.
nature.
See, I'll tell you one example. Like we have a patient of bipolar disorders. This question actually relates with that condition,
Okay.
bipolar disorders. So what happens if the vata is mixed with the rajas? What happens though? The influence of tamas is going down, and rajas is being blown away. He's very happy. He's very happy to give the things, and he works very fast. He finishes the task very early. But once this influence of vata is over the tamas, exactly the opposite behavior comes out. He becomes lazy, he never goes to office, he gets bedridden, he becomes more depressive behavior, and he starts fighting with the people, and he doesn't open to give up to the people. So this is very, very, very tricky with vata, whether it is influencing the tamas or rajas. So that's why it is, the bipolar disorder condition is very, very difficult to treat, because it will be, as you asked, it is very wavy. It moves from here to here and here to here. In
Mhm.
all other conditions, what is happening now, we can control it. But what, as you asked, if there is a dominancy of vata over this one and this one, that's why always we treat vata in all these conditions. If we are able to control this vata so that it again and again doesn't go to such change, especially with medyadravyas and neurotic, like neurotropic drugs. And if you always try to keep it low, you can maintain this. You can't treat it, but you can maintain this. Especially in case of bipolar, you can see that the question relates to that condition. And in all other conditions, we may not see that much influence of vata in other conditions.
Mhm. Okay. 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 Thank you.
Okay. So, so this is like a basic things, because it's a very, very vast science, and we need to have a lot of understanding of human psychology as per different theories. Because we are speaking only on the superficial core of mental health. But when we see the backgrounds of the patients, they may be from different localities, different customs, different religions, different family settings, financial conditions. So many things will come, and each persons will come with a different types of feelings and experiences from their life. So we should listen to them, correlate them, and correlate with what they eat, how they sleep, how they live, how do they believe, how do they understand. And
Mm.
then this threefold examination, especially then again, we need to develop a protocol, especially for Sattva Vijay Chikitsa, then, or how to motivate these people, or how to make a combination of the drugs so that we can reach to their mental and spiritual level.
It's I'm thinking it's interesting that
Yeah.
if a person has kapha dominance, they're
Hmm.
going to have a mental disorder of kapha.
Yeah.
If they have a pitta dominance, they're automatically going to have I mean, we all have a certain level of mental disorders and psychological problems simply because of the nature of the doshas.
Yeah.
And so then when it becomes beyond what's acceptable or appropriate, then I guess that's when it's really needed to be treated. Yeah, because
Yes.
the
Yes.
person will naturally be skilled at being a little angry and sharp and forthright. Yeah,
Yeah.
but then it can
Yeah.
become a mental disorder, a very prominent mental disorder if it becomes imbalanced. Yeah.
Yeah. Yeah.
So in a
Exactly.
way, the mental disorders, when you're dealing with psychology, the
Yeah.
mental disorders is just bringing it to a level of where it's appropriate, right? Because you're never really going to change a person to have like a perfect mental emotional response to all situations. They're going to be leaning one way or another way.
Yeah, that can be. See, that is the thing. But we can do some help in that condition with. But it is happening only through rasayanas,
Mm.
both with physical rasayana and mental rasayanas. We can do that as that. Uh, uh, Now, what I understood that this gut flora. That's what I spoke more about the physical illness today, the gut flora and the mental health, and what a person could be, even though it is very difficult to change what he is both physically and mentally, but we can little help that he may not suffer from those influencing factors which he is easily susceptible. So with rasayana we can do and modification and carrying those modification for his rest of his life.
So with rasayana therapy, are you making a correlation between the influence of the homeostatics like state of certain bacterias in the person's
Definitely.
body?
Yeah. Yeah, now we are focusing on all those things, like we are trying to just I'm just focusing with my trial and error with some combinations of diet and regimen, so that uh, he see if now a patient comes, we treat them and we send them, but he has a susceptible behavior to again and again develop those conditions.
Mhm.
So we need to modify that, both in case of eating behavior, living behavior, like how do he sleep, how do he wake up, what the way he drinks the water before food, after food, or he eats in the street, or he eats in the home, or he's very particularly addicted with some kind of restaurants, because that's what we are trying to think, and we just trying to modify those things, and we see whether this person is again susceptible to for again that, or he is recovering from that. Most of the times we are being successful that he is not developing that until he maintains this what has been explained. So he, when he feels the benefit, he may continue for 2 years, but again he may incline on those things after 2 years, and again he will come back, but we will be successful in carrying those things for most of the times.
With rasayana drugs, so a single rasayana drug,
Yeah.
from what I
Yeah.
remember, is used for all any dosha. Like Brahma rasayana can be used for vata, pitta, or kapha person.
It depends on his prakriti and the condition, what the things. It may be like a single herb or single yoga. Okay, it
What
depends
what
on that. But
what I'm asking is that if the rasayana, if like the general rasayana drugs
yeah,
have an effect on balancing the intestinal flora in their design. even though like one rasayana formula might be used for any dosha. Maybe
No, no, no. It is
weights,
not like that. No, no. It is different for different persons and
different
different conditions. Yeah,
rasayana.
yeah,
So
yeah. Different
not
conditions.
every
No,
dosha would use Brahma rasayana.
no, 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 no. It is not correct because yeah, you can use, but it may not be that much beneficial. And if you understand it properly and select a suitable rasayanas, because there are many rasayanas explained.
Hmm.
We can't prescribe it for all. But there are some single herb rasayanas which can be given for all, like trifla is there, guduchi is there. We can use it with. But if you want perfect, we had to go for proper selection of rasayanas as per his needs.
Uh-huh.
Okay.
Okay.
Okay. So we can we can add still more our experiences on what we can do through this nadis in the upcoming things slides. So
Mm-hmm.
this is how we go on for in Ayurveda, and also in Ayurveda we have an assessment like what you call as by seeing a patient, by seeing the patient's signs, we can understand what is his illnesses. Okay, so that is also there, and also we assess his what are his basic emotions, what we discussed earlier, like in kama, krodha, lobha, and other things. In the earlier recordings we have done, we also do the examination of that and come with this. Along with all those things, we do these things to understand the physical status. So this is
Okay.
how we, what is the main target of diagnosis is to build a suitable treatment protocol as per the needs of the patients. From patient to patient, it may vary. So we need to be very, very thorough in understanding an individual.
Okay. It's
Okay.
I think is this a good place to stop, and then we can do
Yeah.
okay,
Yeah.
yeah,
Another.
because, we're a little bit over.
Yeah. Yeah.
Okay.
Okay.
Thank you very much. Is there any so then
Yes.
next class we'll be moving into what?
Let's see that. So, okay, next class would be management of
Okay.
mental illnesses. Okay.
Excellent. Thank you so
Okay.
much. Thank you so
Thank
much,
you.
Dr. Mitch. I'm
Thank
going
you.
to go ahead and end it
Thank you.
now. And eventually we'll be putting, oh,
Okay. It
okay.
just
Go ahead
share.
and
I have,
end the recording. Okay. Thank you.
okay. Okay.